So when a patient does the testing and gets their results back, and it does show that they have predisposition to one of these syndromes, what do you do about that, and what services are available for them?
I'm actually feel really good about the resources that are in place to support people to understand what their results mean. So I want to start off with everyone who participates will be notified when their results are available. And for people who test positive for one of the three syndromes, our team, the Precision Health team, reaches out to them personally with a phone call to talk through their results and to provide an initial explanation of what those results mean and what are the next steps. So that's one. The second thing that happens is everyone who tests positive is offered a no-cost initial appointment with a genetic counselor. And genetic counselors can talk through what the results mean in more detail. And again, next steps in terms of screening or follow-up appointments, as well as testing other potential family members. So that's the second thing. And then the third thing is, as you're aware, for people who test positive for one of the cancer predisposition syndromes, we also offer to set up an appointment for them with a high-risk cancer clinic so that team really, with wonderful experts in the areas of different kinds of cancer predisposition syndromes, can make sure that they not only have the information, but are set up for whatever screening tests or other kinds of things they might want to do. For individuals who test positive for familial hypercholesterolemia, the recommendation is made for follow-up with their primary care provider. If they're already connected with a cardiologist, they can also do some of that follow-up with cardiology, but certainly with their primary care provider, again, to talk about what the results mean and what options they have and next steps they should take.
That information, I'm sure, could be very confusing,
Yeah.
very distress-provoking, and so it's really great that you have all those services available for them.
And, again, our team is always available to answer additional questions. And we really want to make sure that everyone who gets a positive result back is connected with whatever services they need to understand what the results mean, but also to get the care that they need. I wonder, one of the things that has come up in some conversations is if someone is negative for those three syndromes, and again, specifically for the cancer predisposition syndromes, does that change anything from a recommendation perspective in terms of the screening that they should get? And I, as an oncologist, I know the answer to this, and I think it's a
Right.
really such an important point to
I
make
agree.
for people to.
I agree.
Yeah.
I've heard this from many people that they think that this DNA sequencing that they're getting is a screening test of some type, and it's not. It's just looking for certain genetic changes or mutations or that will predispose them to a higher risk of cancer. But it's not going to tell you if you have cancer. So you still need to get screened. Those patients still need to get screened. They may need to alter the age of when they start screening and the frequency of the screenings, but still they need to get screened because this is not a cancer test at all.
Yeah, right, exactly. So it's a genetic screening test,
Right.
but it's not a cancer screening test. So things like mammograms and PSAs and other kinds of colonoscopies, yeah.
Sure.
It doesn't eliminate the need
Right.
to continue with those
Right.
kinds of screenings. It's such an important
Agreed.
point.
Agreed.
Yeah.